Hi, and welcome back to this edition of Community Health Matters, exploring behavioral health services and treatment at Tri-City Medical Center. Joining us now is Joy Melhado, Clinical Nurse Manager in Inpatient Behavioral Health Services. Thank you for joining us today, Joy.
Thank you.
So what is your role at Tri-City? It's a big title, so what is it that you do there?
Well, yes, I am a registered nurse, and my background has always been in psychiatry. I studied psychiatric nursing, and I've been a nurse for over 25 years. And my role at Tri-City Medical Center is that I'm the clinical nurse manager for the inpatient behavioral health services. I oversee a unit that has 18 beds, and we have about 65 staff, and so our unit is for inpatient behavioral health treatment.
Okay. Before a patient comes to you, so what are the signs of a mental illness? How will someone know that they have one? Or
yeah, that's a very good question. A lot of times it just depends on the actual disorder that someone has and contributing factors. But some of the symptoms that someone may want to look at is, prolonged sadness or irritability. They have highs and lows in their mood. A lot of times people have a change in their eating habits or sleep patterns. They're sleeping excessively or sometimes not even sleeping at all. Sometimes people report seeing things or hearing things. We call that hallucinations, things that are not really there. Mm-hmm. Or sometimes they have this distorted thinking, like the food is poisonous, or they're overly paranoid or suspicious about people. Mm-hmm. And a lot of time in the child adolescent or the college students, you'll see things like their grades are declining, they're not showing up to school, they're defiant to authority figures, or they're having frequent nightmares. These are some of the factors that we see.
Are the patients, because it's an inpatient service, are the patients coming on their own accord? Are they referred? Is it a family member? How do they come to receive your services?
Various ways. We have an emergency room, and that's where we get most of our patients. We see over 500 mental health patients that come through our ER every month. Some patients are brought by the police, law enforcement. Many of those cases are involuntary, like someone's maybe out in traffic, walking through, or trying to get hit by a car, or just digging into trash cans and really not knowing where they are. So police may bring them in on what we call a 72-hour hold for them to be evaluated to determine what is the cause of this. Some patients come from our outpatient behavioral health service. They're referred by them. Some are referred by a clinic or a doctor's office. And then many times people just walk in with a loved one. Maybe they're going through a situation or crisis, and the loved one feels that they need to get some help, and they bring them there to the hospital.
So once that they're there, typically, how long do they stay? What is the treatment? How do you diagnose it? Could you walk me through a little bit about that?
Okay, sure. So like I said, most patients come through the emergency room, and when they present, they usually have a presenting problem. It could be maybe they're having suicidal thoughts, for example. So then we work as a collaborative team. So we usually bring in a psychiatric professional, that could be a marriage family therapist or psychologist or a nurse, that evaluates this patient to determine what's going on. So you're going to ask them various questions to see what's precipitating. Then you'll also have them seen by a doctor. And they want to rule out any medical issue, because sometimes people come in, especially with the geriatric population, they're confused, disorganized, family bring them in, and you find out that they actually have a urinary tract infection, and it's creating this mental state that and they really don't have a mental illness. So we look at the whole holistic approach. We want to rule out any medical issues, and then we're going to drill down and see what's going on from a psychiatric perspective. A lot of time we'll talk to family members or friends to get collateral information so that we can kind of figure out exactly what's going on. And at that point in time, then we kind of determine, does the patient need to be in the hospital? Criteria for hospitalization is normally someone who's a danger to themselves. They're actively wanting to hurt themselves. Or maybe they already tried an attempt. Maybe they took a bottle of pills at home or try to cut themselves. Or someone could be a danger to others. they're acting enraged at home, breaking furniture items. Or the other criteria, we call it, is gravely disabled, meaning that someone, because of a mental disorder, they're not able to take care of their basic needs. They're not showering, they're not getting up in the morning, they're not taking care of their hygiene, their grooming, they're not eating, those kinds of things. So that would warrant more of an inpatient stay. Whereas someone who comes in, maybe they had a breakup with a boyfriend or girlfriend and they're going through a situational crisis, and maybe they just need us to reconnect them with a therapist on the outside that they can talk through those situations and develop coping skills. So that would be more something on an outpatient level of care. So it just kind of depends on the severity of the symptoms.
How many days typically do you keep a patient, and is your services more like an evaluation center before you send them other places? Just want to get a...
So my unit's inpatient behavioral health, so average stay I would say is about 3 to 5 days. Typically if someone comes on an involuntary hold, I refer to it as the 72-hour hold, so it's actually 72 hours, and you said exactly it, it's an evaluation period. And you're in an inpatient setting where you're observed by clinicians to see the behaviors that are exhibiting throughout that 24-hour period. And so that's typically a 3 to 5 stay. 3 to 5 days is our average length of stay.